Some of us might associate the term Minority Report with the 2002 movie starring Tom Cruise. Well, I'm not talking about the movie in this video, but rather how Minority Report relates to the diagnosis of breast cancer. That said, if you recall the movie, its premise has some relevance to how breast cancer diagnosis is made. We are familiar with the fact that non-invasive breast imaging are tests which only provide clues to what is happening within the breast tissue. In order to make a definitive diagnosis, removing tissue from within the breast is necessary through what is referred to as a biopsy. The breast tissue that is removed is sent to the pathologist for interpretation of the pattern of the cells under a microscope for a diagnosis. Such a process of removing tissue is an invasive procedure and carries some risk of complications. Therefore, it is not undertaken lightly. However, even in the best imaging centers with artificial intelligence aids, interpretation without biopsy cannot be 100% definitive. When imaging is interpreted as probably benign or unlikely to be cancer, up to 2% of such findings will eventually be diagnosed to be cancer. However, if doctors were to perform biopsy for all women with these findings assessed to be probably benign, 98% will undergo what medically is termed as a false positive biopsy. Some may interpret such a biopsy as unnecessary. Please bear in mind that while for the far majority of patients such biopsies may be unnecessary, for the minority of women these biopsies may be life-saving. Doctors are unable to tell who will be in the minority unless the biopsy is performed. Personally, as a doctor, I am never confident of a diagnosis based on imaging findings alone. I know of doctors who are and will make a decision that a finding is a cyst on mammogram and ultrasound. Calling findings as cyst gives the impression that the lesion is benign. It makes it doubly difficult for me, as the attending surgeon, to recommend a biopsy against my colleagues' professional judgment, as the majority of patients will have a benign diagnosis, and I could be seen as being avaricious, as I was by another surgeon. As it turns out, I have had situations where the minority benefited from a biopsy against the advice of my radiology colleagues for an early diagnosis and timely treatment, which I believe contributed to better survival for my patient. I share a few of these stories in the hope that patients will understand the concept of minority report and why there are times doctors have to make a call which in the majority may not make sense. It is my wish that this understanding may lead to an early diagnosis for more women and treatment for better cure.